Hello, I'm Dr. Heemstra, and I'm going to talk to you about ketamine and the everyday concerns that we have to entertain when giving the drug. So, number one concern is that the most dangerous thing about ketamine is going to the bathroom. Going to the bathroom genuinely is the most dangerous thing about ketamine. When I'm saying that, I'm underlining the huge safety of ketamine. Yes, going to the bathroom has a fall risk with it if you're under the influence of the ketamine. So it's really more of a danger of alcohol in the sense of falling. I refer to it as a cheers risk more than anything else. What it's really saying is that ketamine is a very safe drug, that we have to worry about the side effects of it, not that much, when it's given in an appropriate mode, which is, in this case, intramuscular. The second concern that we have about ketamine is the nausea and vomiting. Approximately 1 in 3 people will get nauseated with the ketamine. We usually approach this by waiting until you define yourself as being likely to get nauseated, meaning with the nausea. And then we do have medicines in the clinic that we'll give, but most importantly, we want you to have medicines at home so that you can pre-treat for it. So we'll phone in a prescription for you, and then depending upon the situation, you can take the medicines. The third concern that I have about the general administration of ketamine is blood pressure. Most people do get a little bump in their blood pressure. If you have treated blood pressure, oftentimes this must be addressed with medicines in the clinic. We make this assessment as we go, sometimes even asking a patient to visit their primary physician to get blood pressure medicines. But usually it's a very manageable component of the treatment. The fourth concern of ketamine in the clinic is a possible elevation in liver enzymes, similar to what happens if someone has routine alcohol, such as wine with dinner or so. To address this risk, we would ask that if you're still taking ketamine in a year, that you get some basic chemistries from your private physician to make sure that your liver is okay. The last and not least concern has to do with freakouts, bad trips, and ego deaths. They do happen with ketamine, and especially in the way that ketamine is administered in this clinic, where with the intramuscular administration and the gradual increase in dosage, those bad trips essentially may occur. Now, without an IV in place, a bad trip is a whole different situation, and we don't use the intravenous route. I had an NFL defensive end being treated in the neighboring room a few months ago who had a bad trip experience, and he was rolling around in that room. And if that had been in another clinic with an IV, it would have been major problems. But here it just meant that we managed the patient as a cheers situation, meaning as a state of drunkenness, then it was a very manageable situation. The single most important part, though, about dealing with a ketamine bad trip is recognizing that ketamine only lasts 20 minutes, or at least its half-life is 20 minutes. So with a half-life of 20 minutes, it means that if a bad trip occurs, if a bad mental state occurs, with that half-life of 20 minutes, the actual experience would only be 10 minutes. This is hugely different from the old days of stories with LSD, where that bad trip experience could go on for 12 hours. It really becomes a part of normal therapy in this situation rather than a horror to be avoided. So to summarize, the components that we're concerned about with routine administration of ketamine would be the fall risk, number one. Number two, the nausea and vomiting portion. Number three would be blood pressure. Number four would be elevation of liver enzymes. And the last, number five, is bad trip, freak out, ego death. Thank you.